Hi, this is Katie Adams with MedCity-News, and I'm here with Richard Queen, Chief Technology Officer at Sellers Dorsey. Thanks for being here today.
Thanks for having me.
I first want to talk about how technology is supporting Sellers Dorsey's overall goal and mission, which I know is around enabling better Medicaid policy, better value-based care, not just analytics for analytics' sake. So can you tell me a little bit about what the goal and tech, the role it's playing at Sellers Dorsey?
Absolutely. At Sellers Dorsey, the analytics are not just the deliverable, they're also the enabler. So our mission is to increase access, quality, and outcomes for vulnerable populations. So we have to be able to tie these analytics to real-world practical levers. Things like state plan amendments, direct payment programs, quality incentives, quality design, program design, to know how we're moving the needle on these different programs. And so our constant platform, for example, we embed these analytics directly into the quality program design for states and providers so that they know not just how they're performing, but what levers they have to make change and what impact those changes will have. And so it's really about true decision support, not just dashboards.
I'm wondering what that might look like in practice. How are states actually using advanced AI analytics today in their Medicaid programs?
Yeah, most of them are not necessarily using for the flashy headline-grabbing use cases. It's really for decreasing operational pressures. Mm-hmm. So you see it in things like pattern recognition for program compliance. You see it in their quality program design, in fraud detection and other mechanisms that we know that they are looking for. And so it's not necessarily the algorithms that have changed, it's the ability to scale them. So what we've seen in cloud AI architecture and ETL pipelines and other data design allows them to run this at scale now. And so that's what Sellers Dorsey is helping to implement, to make these implement these systems and allow them to scale for states and not just keep them in the theoretical realm.
The ability to scale those tools, I wonder if that is making any meaningful difference in how states are detecting fraud or maybe measuring quality, managing risk. What technology shift in Medicaid do you think most people are underestimating right now?
I think people really underestimate the convergence of the consulting and subject matter expertise with the tech platform and capability. And that's what we're doing at Sellers Dorsey very intentionally, is combining a tech-enabled service model around a SaaS platform that was built around value-based care and population health, because the states don't just want to know, they don't just want to get advice, they want a platform that proves if that advice worked. And so that's the model that we're intentionally building to help them design these programs, but then also help them implement and run these programs and improve the outcomes of those for the vulnerable populations that they serve.
So more of a whole platform than a little one-off point solution.
Absolutely.
Excellent. Well, thank you so much for telling me more about Sellers Dorsey, and I hope you enjoy the rest of the show.
Thank you so much.